नमस्ते बेटा, खुश रहिए आप लोग. आई माई सेल्फ जिगिन प्रतिष्ठा एनर्जी वर्किंग एज एन असिस्टेंट प्रोफेसर इन optometry discipline and the faculty of physiotherapy and diagnostics. I am working in Jyoti Vidyapeeth Women's University in which is the first state women's university in Rajasthan. Today I would like to discuss the fresh topic of visual pathway. What is visual pathway and what are its components? So, firstly, for visual pathway, we should describe about the optic nerve. Optic nerve is an outgrowth of the brain. Its fiber possess no neurolamellar cells surrounded by meninges, unlike any peripheral nerves. Both of the primary and secondary order neurons are in the retina. Optic nerve is having some parts, that is intraocular, intraorbital, intracranial and intracranial part. Then it is having the optic nerve tract, optic chiasma, how the optic nerve lesion and field defects, how these are transmitted through one station to another. This one you have to read in the visual pathway. Optic nerve, you have understood the parts of optic nerve. Then intraocular part. What is intraocular part? Passes through sclera, choroid and appears in eye as optic disc. Intraocular portion is of 1.5 mm which expand to 3 mm just behind eye because of myelin sheet. ONH has 4 portions. Intraorbital parts extends back from eyeball to optic foramen, covered by dura, arachnoid and pia mater. Central retinal artery enters nerve on its inferomedial aspect about 10 mm behind eyeball. Some fibers of superior rectus and medial rectus are adherent to its sheet, so painful ocular movements in retrobulbar neuritis. Intracanalicular part 6 to 9 mm length, closely related to ophthalmic artery. Intracranial part which is 10 mm length, above cavernous sinus and covers with its fellow to form chiasma, covered by pia mater only. Optic chiasma, and the upper station is optic chiasma. Optic chiasma is a flattened structure measuring 12 mm horizontally, 8 mm anterior posteriorly. It lies over diaphragm sella, continues posteriorly as optic tract and forms anterior wall of third ventricles. Nerve fiber arising from nasal halves of the two retinae decussate at chiasma. Decussate means crossed, intersect. Then what is optic tract? Optic tract means the bundles of nerve fibers running towards and backwards from posterior lateral aspect of optic chiasma. It consists temporal fibers of retina of same eye and nasal half of opposite eye. Each optic tract and in LGP. Lateral geniculate body. Oval structures situated at termination of optic tract Each LGP consists six layers of neurons alternating with white matter. Each body is split into six laminae fibers from ipsilateral temporal retina and in lamina 2, 3 and 5 and contralateral nasal retina and in lamina 1, 4, 6. This six laminae divide LGP into two portions. Functions of LGP. LGP is lateral geniculate body. Relay station to relay visual information from optic tract to visual cortex to gate transmission of signals to visual cortex. Optical radiations extend from LGP to visual cortex. Fibers of optic radiation spreads and fan-wise to form medullary optic lamina. Superior fibers of radiation which subserve inferior field proceeded directly posteriorly through parietal lobe. Inferior fibers of radiation first sweep anteriorly in Meyers's loop around anterior tip of temporal horn of lateral ventricle and then into temporal lobe. Visual cortex is located on medial aspect of occipital lobe, subdivided into visio-sensory area and visio-psychic area. Arrangement of nerve fibers are retina fibers from nasal half come directly to optic disc as superiorly and inferiorly. Fibers from temporal half of superior and inferior. Fibers from macular region pass straight in temporal part and optic disc as form. Arrangement of nerve fibers. Firstly, in optic nerve had arrangement of fibers exactly same as retina. Optic nerve had arrangement of fiber exactly same as the retina. Digital region of optic nerve. Proximal region of optic nerve. Macular fibers present centrally. Temporal fibers present temporally and nasal fiber present nasally. Arrangement of nerve fibers. Temporal fibers from retina remains uncrossed and run backward in lateral part of the optic chiasma. Optic chiasma, nasal peripheral fibers. 3/4 of fibers cross over to enter medial part of opposite optic tract is following manner. Lower nasal fiber in optic tract, transverse chiasma, low and anteriorly. Upper nasal fiber is in optic tract, transverse chiasma, high and posteriorly. Macular fibers. Some fibers crossed and runs backward in opposite optic tract. Some fibers uncrossed and runs on same side in optic tract. Then optic tract. Macular fibers occupy dorsolateral aspect of the optic tract. Upper peripheral fibers situated medially in the optic tract arrangements, optic radiations, upper retinal fibers, lower retinal fibers, macular fibers, central part of the optic disc, and the optic nerve. Lesions of the optic nerve characterized by complete blindness on affected side, absence of light reflex of illiterate, and the optic nerve. Lesions for the optic nerve and lateral geniculate bodies. Optic radiation features varies depending on the site of lesion. Involvement of the total optic radiation complete the homonymous heminopia. Involvement of part of optic radiation in temporal lobe, superior quadratic heminopia, inferior quadratic heminopia, and homonymous heminopia. Causes: occlusion of posterior cerebral artery strip of occipital cortex. Homonymous heminopia causes head injury, gunshot injury involving tip of cortex is involved. These all are the visual cortex, anterior occipital cortex. That's all for visual pathway. This lecture is completed, and next lecture will be uploaded soon. Till that, have a great time.